Fantastic. Well, we'll go ahead and get started. We're going to do kind of a two-part session today on data-driven leadership and how data gets used to lead an organization, to choose the direction of an organization, to in some ways justify the direction of an organization, and how information is really a great asset at all of those stages, in all of those activities within an organization. So my name is Rob Lindsley. I'm the Director of Analytics and Business Intelligence for Oracle's North American Public Sector Organization. It's a fun job in that I get to go around and talk to a lot of different customers and government entities, everything from municipalities and localities, state governments, federal and Department of Defense, Canadian provincials, even public sector utilities. And in all of those different places, you see leaders within the organization who have to come in, a lot of times, take over a new role, assess how the organization is performing today, set direction for the future. Very often they know that this might not be where they are going to end their career. They've got to, pretty quickly come up to speed, set the direction, make an impact within an organization in a couple of years, and do it in a way that gets everyone within the organization on board, gets constituents and citizens happy with how the organization is, serving the public, and to do that, they need a lot of information. They need constant answers to questions that get posed, again, internally, externally, from the governor, from the legislature, all of those sort of things. So I want to talk about how data fits into that and how technology helps. I mean, at the end of the day, I do work for Oracle. It is a technology company. I'll bring to bear a little bit of a technical perspective. My colleague will bring to bear, I think, a little bit more of a functional and subject matter expertise perspective, and hopefully the session, putting those two perspectives together, makes for a useful session. So, as I mentioned before, I really want to focus in on two real critical places that data gets used. Obviously, everyone talks about like, hey, I need to make a decision. I'm going to need data in order to do it. I don't just want to go on my gut. But very often in the public sphere, the decision that was made was a decision that allocated resources in one area and not in another area. And the time comes when people say, well, the thing I thought the resources should have been allocated to, well, maybe it didn't get funded. Or, you have to answer questions from the press or from, folks in different constituencies. And so it's making the decision, but it's also justifying the decision and making sure that your organization has a clear, can clearly understand the vision of the overall organization and that everyone within the organization is behind it because they understand why the decisions are being made. A really disempowering thing in an organization is when people think that decisions are made because of backroom deals or positions are made because, oh, the new leadership came from such and such a place. That is, disheartening and disempowering to an organization. When you can go in front of your organization or in front of your public and say, this is how I made the decision, that's a really good place to be in as a leader. So as a technology provider, what do we want to give leaders so that they can realize this, they can make data-driven decisions and lead with information? We want to give them the ability to tap into data quickly and in a flexible manner. So every agency, every large government organization, there's lots of in-house data, and you want a repeatable, quick, secure way to access the information that says, how much money is in each of the accounts, how many people work here on any given day, how much did we spend on road salt in the past 3 months. You need to be able to do those things quickly, but you also need to be able to tap into external sources of information from other agencies, from the private sphere, now from social media and those sorts of things, and so be able to tap into any data. When you're doing analysis, sometimes it is a quick gut. Where do we have the most potholes in the area? How does our population within the correction system break down by offender type or by geography, that sort of thing? You need just a quick and dirty thing. Other times you're trying to do more robust statistical analysis. When you're doing statistics and you want a statistically valid answer, you have to get a lot of information. You have to orient it all the same way. You have to correct for discrepancies, that sort of thing. And so those are different tools. Sometimes a pretty picture does the job. Sometimes you need a full statistical tool set. And so we want to give you the tools that allow you to do the work that needs to be done. And lastly, anytime. So this is both about, on the back end, as technologists, we need the flexibility to be able to respond to requirements within the agency quickly, not have, a 3 to 6 month procurement cycle come before, any project because we have to buy a couple new boxes and get them racked in the data center and that sort of thing. We need the flexibility to stand up new capacity quickly, and we also want to be able to deliver whatever it is that people need, the analysis capability, the answer that they need, whether they're sitting at their desk, whether they've got their mobile device and they're walking into a meeting. So it's everything from being able to execute on a project quickly and then having the results of that project pushed out to people no matter where they are. So you could take kind of take a look at all of these different requirements and all of the different people who are working on those requirements and allow them to go off and kind of do their own thing and use their favorite tool or their favorite technology or their favorite approach. As Oracle, we do think that that presents a whole host of challenges because now, again, the standardization between the data starts to break down. The security protocols start to become cumbersome because everybody's having to set up their own security and go through their own audits on their own. Instead, we think that whether it's serving the data scientist or the application developer, the analyst that's sitting in the finance or HR or more mission critical department, or the end user, the person, the secretary of the agency, or the folks in the legislative branch, we think that having a single platform for them to get this information, do their analysis, has a lot of benefits. Because again, you can set up access to the data once, and then everyone can access it the same way and get the same version of the data. You can set up the security, you can set up the access rights and privileges and routes once and have it reused across all these constituencies. And we think that it's something that we see as a value that Oracle can bring as a large provider of technology services in all these different areas. So we do work with a lot of customers to do these exact things. And like I said, a real joy of my job is to go and talk to, on one day it'll be a K-12 organization and we're talking about optimizing student results or keeping kids in school. The next day it might be the military and talking to them about how they use their human resources to best execute their mission. So all sorts of different puzzles and challenges to put together, but at the end of the day, it's all about how do you have a consistent view of the information within an organization, integrating it all together, pulling in new data sources, and then getting those answers out in a way that's quick and secure and easy for the decision maker to understand. Wanted to give 3 quick examples. The state of Connecticut, not quite as large as California, but still any statewide organization, any statewide system that covers all of the finances for the state or all the human resources for the state. It's a lot of information, and you have a lot of different perspectives, right? The perspective of the Department of Transportation is very different from Child Services, is very different from the state university system. So we've been working with them for several years to put a common information model on top of all of their financial information, their HR information, their supply chain and procurement information. And so now when people ask, how much did we spend on road salt this year versus last year? How much we've got a lot of fluctuation in the price of gasoline and petroleum products. So how have those changes in commodity prices impacted our spend over the past 3 years? They've got one place to go for that information, no matter where they are in the state. One thing that happens when you have that type of visibility into your organization is sometimes you discover you don't have quite as much money as you thought. This is what happened to the city of Phoenix. It was a couple of years ago when some parts of the country, including Phoenix, were really hit hard by the economic downturn. The mayor and the council identified a $100 million shortfall. This was kind of parceled out to the different agencies, and everyone had to come up with their own plan for, giving back their share to make up the shortfall. So the Department of Public Works used analytics to go in and find out, well, in the trash collection agency, I know it's almost cliche for us to talk about things like this, but there was a little bit of, if you left $20 on the dumpster, maybe you got to dump a couple of extra pounds into the collection truck. There were some places where the amount collected didn't quite match up with what folks were paying to have it hauled. They also found some discrepancies in how the routes were being driven and timeliness of the different crews. And so by using analytics, bringing together everything from the financial information for the vehicle location information, the information that was collected when the truck actually tipped at the dump, they were able to figure out ways to tighten up operations and give back the part of the budget that they needed to meet the budget shortfall. So that's kind of an example of, hey, we've got this this challenge ahead of us financially. How are we going to tighten up operations? We want to use analytics to do it and have the agency perform better. Lastly, the quick answer. So we've been working with the state of Indiana for many years across several agencies in that state. They passed the Indianapolis 500 is something that makes a big impact to the economy of the Indianapolis area, but no one's, sometimes that a lot of people come and that must have a big impact on the area, but no one had really quantified it. One of the administrations came in and they put in place some new legislation that kind of had a tax holiday, some reworking of the revenue code with the goal of retaining and kind of, making the Indianapolis 500 as impactful as possible for the state of Indiana. But there were questions. People started to think, well, is this a sweetheart deal? Are we giving money away to special interests, that sort of thing? And so they needed to justify, why did we change the legislation? How is it going to impact, what has been our economic gain from the Indianapolis 500 in the past? How are we going to benefit by making these changes? How is the state going to benefit? And so they did a quick analysis and showed, we're able to lay that out. And again, go back to the public, go back to the press, go back to legislators and explain, here's why we're making these changes, and it's a good thing for the state of Indiana. So again, from the point of making choices and decisions to being able to justify why decisions were made and how it's been benefiting the citizens and constituents in the state as a whole. So I want to kind of put a finer point on this and just show you an example. All right, let's make sure that this goes. Okay. Okay, what we are looking at right now is I am a city redevelopment organization, and this is a kind of I think a classic example of where decisions get made. In some ways, there are parts of the city that get reinvestment dollars, redevelopment dollars, investment, and there's other parts that don't. I mean, in any scenario like this, we're making pretty big choices. Cities can influence, but a lot of the money actually comes from the private sector. These are classic public-private partnerships. And so there's a lot of kind of vetting and considering a bunch of options, and then we hone it down and make our investment decisions. So want to talk about how that can play out in the world today, where we want to be able to tap into internal data, pull in some external data. We want to be able to visualize it in a way that helps us tell a good story. So the scenario is what we're going to see is City of Philadelphia. This is not actually Philadelphia data. I've done this presentation enough times that it's actually an amalgam of a bunch of different cities. So if you're from Philadelphia or your grandma lives in Philadelphia, please don't call her up and say, looks like you're getting a redevelopment project. It's a blend of a bunch of cities, but it is truly what we have worked with several redevelopment organizations to do. So when you go to do redevelopment, you pick a bunch of different sites, and a lot of times you look at different aspects of the sites. So you want to be able to see, you go to the Department of Revenue or your property tax and you say, well, okay, the land in the area is assessed at one thing, and then all the improvements, the buildings that are on the land, they're assessed separately. So you look at the ratio, because if what's on top of the land isn't worth nearly as much as the land underneath it, then investment dollars can go in and raise the value of the neighborhood. If what's already been built there is actually worth just as much or more than the land, then it's harder for investment dollars to come in and make a significant impact. So it's this ratio. So what we're going to do is start out by taking a look at the data within the organization and say, okay, I want to see my different redevelopment areas. I want to be able to take a look at that ratio. So I'm just going to take redevelopment area, take that ratio, drag it out here, and be able to visualize it. And what we can see is the top two areas, Allegheny and American Street, like these areas actually have a lower ratio. So this is actually, these are the type of areas we look for when we're trying to do redevelopment. A better way to look at this, though, might be on a map. If you're going to stand in front of the citizens of a town, they might not know how we have labeled these areas, and so what we might want to do instead is be able to say, okay, let me just bring in longitude, latitude, and I'm going to bring in color. So now what we can see, instead of looking at a bar chart, is on a map up here in the upper right-hand side, the northeast quadrant of Philadelphia. That's where those two areas are. And we can explain to constituents, that these are the areas that we think are, based on this metric at least, are a good target for reinvestment dollars. So I'm going to go ahead and get rid of my bar chart. The other thing we might want to do is take a look at, what type of property exists there. So if I have a development area, let me take a look at total assessed value of the property in these different areas. And actually I can go ahead and bring in property type. And what we can see now is, again, at the top, we have kind of a nice balance between residential property, commercial property, and it kind of stands out that these areas are different than the other areas, again, as far as that ratio goes from existing investments already made and kind of the blend. And so we can say, these two things are leading us to invest in these areas, as opposed to the other areas. Now, the other thing that we might want to tap into is, well, what kind of employment is going on there? It's good to look at an area where we've already got some momentum around, businesses opening or increasing employment. But that I might not have in my Regional Development Authority data set, kind of the governed stuff that we work with all the time, about getting feeds from Department of Revenue and that sort of thing. And so I might need to pull in some information from the Department of Labor. So what I'm going to do is upload a file, download some information from the Department of Labor or from our, business tax, our partners on the business tax side, and employment property values. There we go. And I'm going to upload information about our employment trends in these various areas. I'm just going to change that to be year, add to project. It's going to give me a message that I've already added this, or I've already tried to do this in the past. And now it's just telling me I've joined it in, so I've got information, another set of information about my redevelopment areas. So now that data exists over here on the left. I can go ahead, I'm going to add in a line chart to do this. Do a line chart, and I'm going to say, give me year, give me total employment, put it down here, and maybe I'm going to break that out by redevelopment area by color. So now what's nice, again, tapped into some external sources of information, and now when we go in front of everyone, we can say, okay, in the northeast of Philadelphia, we've got the, a good ratio of existing investment to the underlying property value. We've got a good ratio of residential property to a commercial property, and so we can kind of do some good mixed use development with some public-private dollars. And we can actually see, if we click on these, it's going to highlight down here in the line chart toward the bottom the employment trends. And so you can see there's a slight uptick. You know, if I'm being a bit of an optimist, there's a bit of an uptick going on in this Allegheny area. And then again at American Street, we had a little bit of a downdraft after the recession, but now it seems to have stabilized and we're kind of on the uptick there as well. So now, again, use the information to select the areas, but also when folks from those other dots on Philadelphia come and say, well, why wasn't the project located, you know, down in Southwest Philly, we can point to the ratios, we can point to the mix of property types, we can point to the employment trends in those areas and say, this is why we made the decision, and we stand by it, and, you know, hopefully this makes our constituents feel good about what we're doing, and also, again, gives the folks within our agency, you know, some clear understanding of the mission and the direction and why we do things the way we do, and keeps them engaged and empowered. So wrapping up the, I'm gonna talk technical for just a couple of seconds, because what we saw just then was different than how IT organizations, agencies have traditionally approached information you know, within their four walls. Very often what folks did in the past was, you know, they had their core mission support systems. That was everything from case management systems, financial systems, HR systems. They would build a data warehouse or, you know, a set of databases that had that information and try to push that out via reporting interfaces or business intelligence interfaces within the organization. And then if you needed that new information about employment or, you know, some other data set to make your decision, you either had to go to IT and file a change request and wait for them to bring the information in, which could take a long time, or you ended up having to bring it all down to your desktop and mash it up in Excel or Access or that sort of thing. So what we're seeing more and more is people want to be more agile than that approach and have it be a little bit more repeatable and secure and flexible. Is there, you know, on the right there, you still need that. I mean, there is still a place for a one-stop shop to know how much money is in each account, or, you know, how much did we spend with a particular vendor over the past 5 years. That should be standardized and available to everyone who needs it within the organization. But folks should also be able to bring information in, like I brought in that those employment statistics. We're seeing more and more organizations invest in what they're calling data reservoirs or data lakes, or places to land information quickly, and then they'll use it almost on an as-needed basis when these type of questions come up, like, you know, what was the impact of the Indianapolis 500 on our business tax collections over the past 5 years. So, you know, we see essentially it's a fundamental change to that information architecture and the way information is managed and provided within an organization. We also see that folks want to be able to do these projects quickly, and so people are leveraging cloud technologies more and more because it gets around just kind of the physical constraints of what can our infrastructure support in our own data centers. Cloud allows people to spin things up quickly, answer the question at hand, and then if they want to, they can even shut it down and stop paying for it once the question, you know, the question has been answered or the need has passed. What we think a partner like Oracle can provide in these scenarios is the ability to use the same technologies, the same skills, the same tool set, whether you're doing it on premises in your data source, whether you need to spin something up in the cloud, whether you want to move things from one to the other. We want to give folks choice and transferability because we see more and more people are taking this approach. It is an incremental change, and so you should be able to make choices today as they make sense to your agency or organization, your balance of cloud and on-premises activities today, but be in a position to evolve that over time in a way that doesn't leave you shackled to one or the other. And lastly, we are a huge area of investment for ourselves and for the entire industry is mobility, being able to take those same answers that I was deriving standing up here in front of all of you, being able to do that on an iPad, being able to get those answers on your phone when you're sitting in a committee meeting, being able to push those out to any sort of device. So, oops, I'm sorry, I didn't notice that I was still in kind of edit mode. So, pretty pictures, I don't want to waste the pretty pictures in layout mode. So, again, this is an area that we are making significant investments, but we, again, want, just like we want to give folks the flexibility to deploy either on premises or cloud and evolve as needed, because it doesn't have to be reworked or changed depending on the deployment option. We want to take the same approach to mobility, whether it is being delivered, to a desktop, to a laptop, to a tablet, to a phone. You should be able to develop the content once, provide the insight once, and have it delivered to any platform. So those are the things that we see driving data-driven leadership, the ability to make data-driven decisions. Happy to answer questions at the end of the session, but at this point I'm going to turn it over to someone who makes data-driven decisions in real life on a daily basis, and look forward to hearing her content. Oh, actually I will put you in display mode, so your slides will be pretty. There we go.
Well, so, sorry.
There we go. I forgot.
All right. Can you hear me all right? Okay. Excellent. So, is it on?
There you go.
We're good? Okay. All right. Got all the technology worked out for the technology environment. So first of all, let me tell you a little bit myself, and then I'm going to ask you a little bit about you. So my name is Lynette Scott. I'm a physician. I was a Navy physician, and then I came to California State Government, worked at Department of Public Health, and now I serve as the Chief Medical Information Officer at Department of Healthcare Services, so in the Health and Human Service Agency. As I was listening to Rob talk, I did the quick check, and numbers often speak volumes, right? So in Medi-Cal, I think we're up to almost 13 million members, so we're the 5th largest state in the largest state of California. It's just kind of awe-inspiring when you see numbers that big. We hear about other states, and then we look at where we sit in comparison, and it's very overwhelming sometimes, the quantity of data we have in California. So I want to do a quick check, though. So how many folks here would call themselves a data geek? How many folks would call themselves an executive manager type? How many are more use the system, run the programs, day-to-day work? Government? Non-government? This is a government room, by the way. Terrific. Well, one of the things that, the session was put together with the idea of data-driven decision making, and we all use data to make decisions every day. So essentially what I just did is I did a survey of the room to check and see where we were at, and I'm actually using that to input and make decisions about what we're going to talk about. You use data every day. You use data to decide which sessions are you going to go to. Are you going to take this route or that route to work? But we do it in our job too. And one of the things, so I would be in the data geek category, so I'm trying to make sure I translate. When we come to work and we look at our organizations, again, our organizations in California often are very large. They're not all large, but even if the organization itself is not large, the population we're serving often is. And so it's very hard to translate that into something that's understandable. To say a third of the state is in Medi-Cal, and that's over 13 million or about 13 million people, it's so big it's hard to get your hands around and understand what it means. So a key role that we play as we use data and think about that is how do you translate that into something that you can use to decide who do we reach how to result in the best outcomes that we can. So I've included a few slides sort of as backdrops, but one of the other things I wanted to check in with you about, how many folks have heard about open data before today? Open data today? Okay. And how many of you have data from your organization that's part of some sort of open data type initiative? And are y'all in Health and Human Services? No? Good, good. So within California Health and Human Services, we have had an open data initiative that actually kicked off about 1.5 years ago now. Our Department of Public Health really led the charge, followed by our Office of Statewide Health Planning and Development. Department of Healthcare Services was the third department to come on board, and at this point we have 11 departments and offices with 296 tables, charts, and maps that are on our open data portal. And the key thing about that is that it's not just there, but it's downloadable, it's visualizable, and it's API enabled. Are folks familiar with APIs? Yes, sort of. So API stands for Automated Programming Interface. Did I get it right? Okay. The translation of that is, it means that once we post our data on this open data portal, those clever app developers that are designing those things for your phones, this, that, and the other, they can use the data, design an application, make it available in all kinds of ways that we don't have to pay for, oh, by the way. Remember that part? We're government, so that's important. And then make it usable to the person who actually wants to use it. And that's one of the things that we struggle with frequently, I think especially from where we sit at the state government level, and then certainly at the county as well. But we have so many constituents. If I post data, how do I know who I'm talking to? Am I talking to the general public, to providers, to plans, to legislators, to media? And the story might actually need to be a little bit different depending on who I'm trying to help with that data. So one of the aspects about putting our data into this kind of environment is it opens the door for others to help us tell that story to the people that need to have it, and then be able to make decisions. So we have been really thrilled to follow the lead of our Undersecretary Mike Wilkening over the last 1.5 years as we've been adding data. And all of our departments, we started small. We started with a couple of data sets, and then we started adding to it. And it's grown. And so one of the things again here is this is one of the visualizations. So this tells a story of certified eligibles in Medi-Cal that are in fee-for-service and managed care. So the bottom part of the bars is the fee-for-service, and the top and widening part of the bar is managed care. And what you see over the last 2 years is we really have seen a tremendous growth, going from on the order of 8 to 9 million now to, again, going on 13 million, with the vast majority of those folks in managed care. So our managed care plans are huge partners in taking care of folks. But again, because this information is available in this way, now many other people can use it and turn it into other kinds of tools and visualizations. And then we also have taken this and put it back into our website so that we can post things potentially in one location and see it in many locations. So we're also working on that kind of thing. One of the things that's sort of interesting though, and I think we're often faced as we're thinking about how do we use data to drive decisions, is it really matters how you present it. So if you look at the kind of the bottom half of this screenshot, you see numbers. And so it goes from, September to October, November, and the numbers go from 2.68 to 2.79 to 2.485 million people. And it doesn't generally, tables don't generally have the same impact that visualizations do. One of the things I remember somebody talking about quite a while ago, they were looking at trauma centers in the state, how to help provide funding. And one of the things that was very powerful was taking the trauma center locations, you put it on a map, show where the major freeways are, and then be able to say, look at where the gaps are, right? They're not necessarily where people are driving long distances up the middle of the state, so how do we help provide services there? Whereas when you see it in a table, it just doesn't always have the same impact. So how you visualize, whether it's a bar chart, a line graph, a map, can be very important in how it makes an impact and how it comes real to folks. When I started with the state, one of the areas I spent quite a bit of time in was using GIS, Geographic Information Systems, so doing mapping with the data. And again, because we're so big, it really helps to translate that, and it gives you a much better sense of, again, where do you need to do the resources. So as Rob was showing in his demonstration, one of the first things he pulled up was a map, and then he started putting the data on top of it. And part of that is because when you see the map, you start to say, well, okay, so where's my house? Where do I live? Where do I work? And it's one of the ways to start to personalize it. One of the things in terms of having data drive decisions is to try to frame it in a way that whoever you're speaking to can understand it and own it, right? If it's too abstract, it's kind of like, oh yeah, it's that statistic in the air. It doesn't mean much to me. But when it starts to draw to you in some way, then you can relate to it, and then you're more likely to get a connection around it. So really thinking about your visualizations and what you put on top of it to help that data speak is important, and so something to keep in mind as you're presenting data. Also thinking about the story you want to tell, because we often in government, our role is to present information and let people understand it and use it to make decisions, especially those of us in kind of the more data technology support. We're supporting the policy decision making. So it's, the facts, just the facts, right? But depending on how you present the facts, it can have a very different impact. And so again, this gets at the visualization. So my training is, I have a master's in public health. I'm a board certified physician in public health and general preventive medicine. So I can't do one of these things and talk about data driving decisions without talking about John Snow. So how many folks have heard of John Snow, England, 1800s? We think of him as the father of epidemiology, so somebody who certainly tried to use numbers to drive decisions. There's actually a recent book called The Ghost Map that I would highly recommend that talks about the story of John Snow. And so he actually was an anesthesiologist back in the late 1800s. And so he had this sense of understanding that when you provide gas, like an anesthesia, it behaves in a certain way. It tends to affect the person that's closest to it, right? So at that point in time, the theory was that disease was spread by something called miasmas, which was odors, smells. We didn't understand things like vectors and disease transmission, and if you cough on somebody, they might get sick from you, and that kind of thing. That wasn't part of the understanding. The thought was these bad smells transferred disease. But that didn't necessarily make sense based on his understanding of how gases work. So he, as well as many others, during one of the outbreaks in England, in London, his approach was to take the statistics coming out of what we would call the state registrar or vital records, the folks that kept track of all the deaths, and he started mapping it out. But he also mapped it out with his feet. So he went door to door. He tried to figure out what was different between this location and that location. Why did people get sick? I mean, bottom line, he figured out, and he had figured out before, he just hadn't made his case yet, that it was spread by water. And so it depended on where your water came from as to whether you got cholera or not. It didn't matter how close you lived to the miasmas or the bad smells or the sewage. It was, where did your drinking water come from? So he knew that, but he had trouble making the case. And so part of what finally made the case, though, was the visualization and mapping the cases and showing how they all were in this really good circle right around the Broad Street pump, and actually managed to convince folks, going against all common knowledge, to remove the handle on the Broad Street pump. And as it turns out, in the more detailed retrospect, prevented a whole nother outbreak. And it was one of those things, it killed many, many people. It decimated the community of the cholera outbreak. So, it was one of those, the decision was driven by the way the data was presented. The data was around everybody, but it took the presentation and the visualization to make the case. And we see similar stories kind of throughout history in New York City. Again, the miasma theory of disease, they figured out that where the bad smelling water was where yellow fever seemed to transmit. Well, they decided, well, if they clean up the bad smelling water, then hopefully that will help the yellow fever deaths. And it did. So in that case, they never figured out they got the theory wrong. It was the mosquitoes that lived in the bad smelling water, not the bad smelling water. the fix was the same, yellow fever went away, it was good. So sometimes even if you don't have the full causal history, you can really make good decisions and drive that by understanding where things are happening and then what happens in response. So another thing that, as we think about data-driven decisions, is thinking about our common goals. Having a common goal really is a huge piece of this. And so one of the major initiatives for us in Health and Human Service Agency is the Let's Get Healthy California work that has been occurring over the last several years. So this was a governor's executive order in 2012. The secretary for our agency convened a task force, and in 6 months they came up with this set of goals and objectives and identified 39 measures that we're going to measure over the next 10 years. With the goal around making California the healthiest state in the nation. And it's structured around something called the triple aim, which is better health, better care, lower cost. So in healthcare, this is something that's been embraced across the country nationally as part of the National Quality Strategy, the Affordable Care Act, kind of everywhere you can think about it that touches health. But the idea is kind of you have three different things: the quality of the care, the quality of the people and the health of the people in the environment, and the cost. And it's kind of like your project management aspects, right? You have time, you have cost, and you have materials, and often you could do it really fast, but it'd be really expensive. So you're always doing this balance, and this is true in the triple aim too, that really high quality and really low cost often don't necessarily go together. But it's a balance. We want to keep it all in balance because it's the triad that moves it all forward. So within that, we have these set of goals, and this has grown to become part of our state healthcare innovation plan, and we have a number of initiatives that are driving this. And so really this kind of leadership is really helpful because it helps us align our messaging, what our reporting is, and it's something we see throughout. One of the stories in terms of the common goals and the knowing what we're here for is the NASA story that everybody in NASA knew what they were here for. Even the janitor knew he was there to help get a man on the moon, right? So kind of a common project management story. But it plays out in terms of how we think about framing data to drive decisions. So if you know what the common goals are for your organization and you can frame data in that context, it again helps draw that personal connection to it that will help people understand and think about what does this mean to me, the sort of the WIFM, what's in it for me. So we're very excited in our agency that we've recently launched a new website, Let's Get Healthy California. So again, how do you take data to then drive change? And this just launched last week. Lots of leadership from our Department of Public Health as well as obviously our agency secretary, Diana Dooley. And we really have a platform there to help draw these connections, and it filters throughout our different program areas. A key part, though, of this platform is to report performance and to have a way to share stories about how people are moving the bar. So there was a kickoff conference last week, and one of the sort of tidbit stories is that there was a competition, who are the innovators in the state? And so Orange County has a health officer that's really been focused on homelessness and hunger, food issues, and so has really worked to help draw connections between restaurant industry, food industry, and all that leftover food that happens when you have large conferences and people don't show, and working through all the issues to help reassure folks, yes, no, you can donate it to the local food kitchen or what have you and get it to people who need it. And they've really focused on that. So he was here for the conference for that award, and at this conference there were 70 meals unused, and it was one of those, the connection was drawn. Everybody said, yes, no, you can safely do this. If you prepared it safely, you have no liability, you can pass it on. So those 70 meals went to Loaves and Kitchens here in Sacramento. But the idea around this is, again, having a common goal around addressing health for our communities, and then what is it going to take to get there, and having a way to share the stories and move the bar. So the other thing I wanted to highlight kind of here as well, and this is one of the things I think we often feel when we're getting ready to share data, is well, what if the story is a bad story? What if it says we're getting worse, right? And inevitably that's going to happen. If you tell the story enough and you actually follow the data, there's going to be times where it says we're doing better. There's going to be times where it says we're doing worse. We're staying the same. In this screenshot, the 3 measures I happened to pick for our baseline, current rate, and target, we're actually staying the same on. But there's some of these we're doing better and some we're doing worse. And I think that's one of the things that's hard to address sometimes is how do you communicate the data when it isn't necessarily telling the story you hoped it would. And that's one of the kind of the cultural changes I think that's happening for a variety of our organizations, is to be able to embrace the data, whether it's positive or negative, and then understand what are you going to do about it, because that's really the question. So if it's getting worse, does that mean you throw in the towel, you're done, it's not worth it? Or does it mean you need to reevaluate, reassess, and change your plan of action, and you do it early so that you don't go too far down the road that's not going to be effective? So I think the reaction and the culture that you can bring to a data-driven decision and how you frame data, whether it's good or bad, that says, well, if it's good, it's going the direction you want, well, that's great, but how can we still make it better? Does that mean we're really on the right track? What's coming next that might change our outcome and our trajectory? But the same is true of when it's getting worse, right? And sometimes when we see it getting worse, sometimes the answer is simply we don't have enough resources against it. Well, that helps us tell the story, right? Why should we put funding, or why should we put resources here? Because if we don't, we see which way it's going, and if that's a priority, we'll change that. So the data helping to drive the decision, it's being comfortable with it showing either way, and then helping to frame it and helping to turn it into action so that people don't just see the data and then feel that sort of helplessness, or, well, what can I do about it? So again, a key part of our Let's Get Healthy California and our focus around that is making sure that we have things we can do. What else are other people doing, and what can we do about it? So given our timing, I actually want to close here. In terms of sharing outcomes in our data, there's again lots of ways of doing it. At Department of Healthcare Services, we have a number of different ways on our website, from our PDF reports to our embedded open data visualizations. And I think the story is we all are continuing to grow and learn and understand. And a key part of that is understanding what makes the impact for those that are using the data and trying to make decisions from it. So I will close there, though. And I think we have a few minutes for questions. And we really appreciate you being here and being part of the journey of data. So thank you. Questions? I know it's the middle of the afternoon. You're all good? Ready to go? Yeah? Open Data Portal? Mm-hmm. I think we have one more department that's coming on board. So but we're almost at 100% in terms of departments and offices in the agency on the Open Data Portal. I think that the other part of that is we have some departments that have lots of data sets. So like Department of Public Health was one of our leaders, and they have a lot of choices. There's others of us that have a few, but the point is we're continuing to look at what are our easy opportunities, so to speak, relatively low effort, but things that people are asking for. So what are you getting lots of PRA requests for? Is there data you're already posting on your website, but you put it into a 500-page PDF, for example? Can you post it differently so that it could be more usable? So we're all going through that process of looking at our different kinds of data in terms of what to make available, and then recognizing that as we work through it, we'll get to additional items. Any other questions? I guess we're all quiet. All right. Well, then we won't keep you over time then. But thank you again, and look forward to working with all of you throughout the state. Thanks.